Hello, this is Leanne Kaiser, and this is current event number 7, Vaccinations and Anti-Vaxxers. This is from an article that was Biden's Next Fight, Anti-Vaxxers Jeopardize Plans to Protect the U.S. Against COVID. It was published on February 10th of 2021 and written by Berkeley Lovelace Jr. in Health and Science. According to the estimates by the World Health Organization, WHO, vaccinations save 2 to 3 million lives worldwide each year. Nevertheless, a considerable amount of children or adults are not getting vaccinated, leading to outbreaks of vaccine-preventable diseases and avoidable deaths, such as from measles or pertussis. The Centers for Disease Control and Prevention, CDC, ranked vaccinations as one of the top 10 public health achievements of the 20th century. The impact of vaccinations have been dramatic in the U.S. It is one of the most significant factors responsible for decreasing infectious disease incidence and corresponding increases in life expectancy. However, not everyone feels the same about vaccines and their efficacy. Scientific evidence has proven the efficacy of vaccinations to protect the body from infectious diseases and that vaccines are safer than ever before. However, not all children in the United States receive mandatory vaccinations, and a portion of the population remain voluntarily unvaccinated. Vaccine hesitancy. Vaccine hesitancy has been described as the delay in acceptance of refusal of vaccine despite vaccine's availability. This concept is influenced by factors of complacency, convenience, or confidence. Hesitancy is a continuum between complete acceptance and complete refusal. The term hesitancy has been criticized as the behavioral definition neglects that hesitancy can be a psychological state of indecision. So lots of vaccine hesitancy is seen right now in our current situation with the COVID-19 vaccine. So the 5C scale. So when we talk about vaccines, they're on a 5C scale as far as how people feel about them. The 5C scale provides a long and short version to measure the 5C psychological incidence of vaccination: confidence, complacency, constraints, calculation, and collective responsibility. Confidence is defined as trust in vaccines' effectiveness and safety, the system that delivers them, which includes the reliability and the competency of the health services and health professionals, and the motivations of policymakers who decide the need for vaccines. Those who lack confidence might have negative attitudes toward vaccination, which guide behavior. Misinformation, belief in conspiracy theories, and increased perceptions of vaccine-related risks contributed to the negative attitude. Complacency exists where the perceived risk of vaccine-preventable diseases are low and the vaccination is not deemed necessary as a preventative action. Complacent individuals do not feel threatened by infectious disease and thus have no incentive to change their prevention behavior. Since prevention is future-oriented, there is no consideration for future consequences. Constraints are an issue when physical availability, affordability, and willingness to pay, geographical accessibility, ability to understand both language and health literacy, and appeal of immunization service affect uptake. Travel time or inconvenient procedures may also act as barriers. Calculation refers to an individual's engagement in extensive information searching. It can be assumed that individuals high in calculation evaluate infections and vaccination risks to deduce a good decision. Individuals high in calculation would be risk averse, and avoiding risk may be an essential motivator. We define collective responsibility as the willingness to protect others by one's vaccinating, utilizing herd immunity. People high in collective responsibility are willing to vaccinate in another person's best interest. So, for example, when we talk about herd immunity, we're talking about I would get the vaccination in order to protect you, not necessarily just thinking about myself. So thinking about getting the vaccination for the good of all mankind is where we are with herd immunity. So this article talks about Biden's fight against the anti-vaxxers movement. So according to the CDC study, just under half of adults in the U.S. said in December that they were likely to get vaccinated with the COVID-19 vaccine. That's up from 39.4% of people surveyed in September. This is far from the Biden administration's goal of 70 to 80% of the U.S. population needed to achieve herd immunity and suppress the pandemic. So the statistics are saying we need to have approximately 70 to 80% of the population in the United States to receive the COVID vaccine in order to receive herd immunity and suppress the pandemic totally. The Biden administration and his medical experts believe this hesitancy and refusal stems as far back as 1998 from the long debunked study published by British researchers linking measles vaccine to autism in children. Whereas former President Barack Obama states that the Black and brown communities also still have a painful memory of the Tuskegee study, leading to their skepticism of the vaccine. A poll conducted by the Association for a Better New York found that 78% of white residents would take the vaccine, compared with 54% of Hispanics and only 39% of Black residents. These issues have fueled the anti-vax movement. So lots of demographic data here about how each culture and each race is accepting or not accepting the COVID vaccine. There's also lots of communication about barriers that exist in some of these communities, especially low-income communities. Do they have access to technology such as the internet or devices that can be used to schedule these appointments to receive vaccinations? So lots of speculation as to how not only vaccine hesitancy as a whole is affecting the herd immunity and the volumes of shots needed. It's also talking about barriers that exist, meaning social determinants of health, that are impacting the decision to get the vaccine. Maybe they want it and don't have the capability to do so. So to gain the public's trust and increase vaccination rates, some cities and states are launching outreach education campaigns regarding the COVID-19 vaccine. Some healthcare workers are posting they're getting their own shot on social media to increase confidence. Most people state that their main concern is the speed at which the vaccine was created and that they would like to see more people get vaccines before they get in line to receive them. So some people are saying they're not resistant to getting a vaccine. They just would like to see more data and more time to pass with people who are receiving the vaccine. So I think this is also going to impact, our overall timeline that was expected for vaccination. There are also certain areas of the country and within the states where the demand is much greater than the supply, and we're seeing that now, where we need to get much more vaccination serum out there to be able to meet the demand of the current population. We are finding that the tiered program that's been developed, the 1A being the healthcare workers in the state of Illinois, the 1B being 65 or older, has taken a lot longer than anticipated to move on to the less than 65 with current comorbidities, which is the next group to be able to receive the vaccine. So they're doing a lot more education in the communities for the current population that's eligible to receive it. One of the groups that has had a lot of hesitancy of receiving the vaccine has been nurses. And the concern is that hesitancy by the nurses somehow affecting the population not receiving the vaccine. So, a lot of times patients spend more time with the nurse than they do with the provider. They get to know those nurses, they trust those nurses. And so if they find out that nurse has not yet received her vaccine or has no intentions of getting her vaccine, is that impacting that patient as to whether they decide to get the vaccine or not? A lot of controversy, a lot of discussion surrounding that right now, and wondering if that's going to ultimately impact the total numbers of vaccinations. So as you see, a lot of passionate folks on both sides of the vaccination issue, but obviously this one's right here, no forced vaccines. So a part of President Biden's plan to help end the pandemic is to launch a public health information campaign to rebuild trust in vaccines and help the United States understand what science is telling us about the efficacy of vaccines as a whole. He realizes they will never impact the conspiracy theorist groups, no matter what is said, but he hopes to impact the American hesitant groups. So, we know that the conspiracy theory folks are probably never going to be convinced, regardless of what information is produced. They don't want to know how safe the vaccine is. No matter what the administration does, they're not going to believe it. So those conspiracy theorists, he said that is that person who is going to believe the data no matter what you tell them. They're not going to believe what's out there. They're not going to believe the data. They think pharmaceutical companies have the government in their pockets, and they're not going to believe anything you tell them. There is a lot of concern about who's backing the vaccines, how quickly things were put out there, and is there an ulterior motive there? Conspiracy theories run amok and are getting big audiences on Twitter and Facebook. One of them postulates that billionaire tech mogul and philanthropist Bill Gates wants to use coronavirus vaccines to implant tracking devices in billions of people. Another conspiracy theory says that COVID-19 vaccine changes people's DNA. Neither theory is true, leading scientists say. Facebook has launched a new global policy that bans ads that discourage people from getting vaccines, though it still allows ads that advocate for or against legislation for government policies around vaccines, including the COVID-19. So, lots of people trying to influence decisions, utilizing Facebook to block those and ban those ads discouraging people from getting the vaccine. So, but most people aren't conspiracy theorists. It'll be up to the public officials and drug makers to be transparent about what they know about the vaccine, including what they don't know about the vaccine and any long-term effects. So, it's going to be important moving forward that we be as transparent as we can with these individuals that are hesitant, in hopes that we can sway them to receive the vaccine. So the anti-vaxxers, they've always thrown out the autism, dating back to that study. They've always thrown out allergies. They're talking about not needing vaccines at all. But, we're jeopardizing the overall herd immunity to get back to normal. And I think at some point we have to think about society as a whole and what the long-term effects of leaving our country in the state it's in right now, of not being able to move forward, the communities not be able to open back up, businesses not being able to thrive and succeed. What is our long-term effects of that going to be if we continue to have the mask mandate, have the reduction of businesses to 25 or 50% of their capacity? What is this community going to look like moving forward 10 or 15 years if we continue these? And the anti-vaxxers spreading the propaganda that it's dangerous is only going to feed and fuel those hesitant patients to not vaccinate. So, whatever any of the government officials can do to hopefully refute those claims of, being injected with a tracking device, or, that you're going to receive autism in children or from vaccinations, or that, you're suddenly going to be, providing something that for these pharmaceutical companies that is not the case, and to refute the fact that the cost of the vaccine. Right now, the government is providing that vaccine at no charge to patients. So this, cost is not a factor here, which is atypical of our healthcare system. It is not impacting this decision. Patients can receive the vaccination at no cost to them. So this graph I thought was, pretty telling. Logic, facts, science, data, reason. They put all of these into the vaccines. And this person says, Psh, I don't trust those ingredients. So again, we're jeopardizing herd immunity by the information that's being put out by these anti-vaxxers, or not accepting facts that's being put out by the medical community, the scientific community. Sometimes the more we say about something, the worse it can be. Sometimes if we let time pass, which is obviously not what we want in this case, we obviously want to try to resolve the pandemic as soon as possible. But sometimes these patients just need a minute to sit and think and do their own research, listen to the information, and be able to move forward, and we'll make the decision to ultimately be vaccinated. So this is something that I've noticed recently is, you can't have a conversation or a debate about this issue without it becoming personal for some folks and becoming an ugly situation. So it is a personal decision as to whether you feel like the COVID-19 vaccine is for you or not. But they're passionate about it. It becomes a difficult decision. It can break friendships. Personally, I have had the vaccine. I've had both vaccines, both shots. I received Moderna. I had very little problem with it. I received my first injection. I did have injection site pain for a little bit, a couple of days of some pain in the injection site area in that arm. No other side effects whatsoever. No fever, no problems at all. Received the second injection, which is the one they're saying they're most likely to receive side effects from, and I had absolutely none, not even site pain reaction, no pain, no fever, no nothing. And so I will have to say, for all the discussion out there, there has been a lot of information put out about people having complications, concerns, issues. I had very little of those the first time and none the second time. For me, I am a proponent of getting the vaccine for herd immunity to get back to some semblance of normalcy. The science, if you'll do your own independent research, you'll find that the science is supported. It is something that is, it is there. The science is there, and the rationale and the research is there. I will agree that this was what perceived to be a quick process. However, those of us who are in academic medicine know that they have been studying this type of reaction, this type of illness, for a number of years. The coronavirus type virus has been around a while. We saw it in a variation of H1N1. We saw it in SARS. And so they've been studying it for a number of years. And so we already had a much bigger lead on the cure or the vaccine for a potential cure of the process than that was perceived by the public. Those who are in medicine knew that, and those who are in academic medicine knew that. Sorry. Those that were in research knew that. So the perception of time and how quick the vaccine was done and approved is a big part of the vaccine hesitancy, and is a big proponent of what the anti-vaxxers are saying is their issue is the quickness to market. And I understand that concern, but I encourage you to do your own research for the vaccine and decide what's best for you and your healthcare situation. These are the references I used for this presentation about vaccines. If you have any questions, please don't hesitate to send me an email. I'd love to discuss it.